And on this very day, International Nurses Day 2020, I just would like to share my experience and some expectation as a nurse during this global pandemic of COVID-19. Last year, the International Council of Nurses has set the theme for Nurses Day 2020 as Nursing the World to Health, with a focus on the value of the nurses to the people of the world. And all of us nurses were excited. We were expecting something special because WHO declared 2020 as Year of Nurses and Midwife to coincide with the 200th anniversary of Florence Nightingale. But what we have here today is something very different. Our world has been hit with a global pandemic, which became a very big challenge for us, and I would say we were definitely not signed up for this. Honestly, when I go for work, I feel like I'm working in a war zone with limited resources and limited supplies, and very less staffs and healthcare workers, because every one of us are overwhelmed. We do not know what we're dealing with. We do not know how long this is going to take. This is a scary time for the world, and believe me, it is a scary time for us too. The world needs us today, and we have to be there in this hour of need, in spite of all the difficulties. I want the people to acknowledge this and stop stigmatizing the healthcare workers. My duty timing for morning and evening shift are 6 hours each, and 12 hours for night shift. It takes a great toll on our mental and physical health to be entering the ICU knowing that it is highly infectious. And we sweat profusely under the PPE while assisting the patient, and our vision gets blurry because there are fogs form on our eye shields, and sweat dribbles into our mouth while we serve water to the patient to drink. But once we wear our PPE, we cannot remove it. We cannot even have a sip of water. We get worried when the patient's vitals are not stable. We get worried when the patient doesn't pour urine, but we have to hold our urine for the entire shift. We have to ultimately we have to hold everything that our basic needs. We have to hold our basic needs for the entire shift. It's not only the challenges of this COVID-19, but healthcare workers have another challenges, that is wearing PPE and holding back our basic needs and providing care to the patient. This has become a very big challenge for us. What I want people to know is that this pandemic wave came and people are dying without any accidents or other health issues. Once the patient is admitted into the hospital, they cannot be visited by their relatives, and some even die on their own without their families around. It is very hard because we are the one besides them. We use WhatsApp and we allow them to use mobile phones to communicate with their families, but it is still hard because we know that we cannot replace the presence of their family members, and sometimes it is very painful to know that this is how they might share the last moment with their families. Of course, many people also do get well and are being discharged back home, but we cannot take that for granted. We have to be very careful. People still need to maintain social distancing till this pandemic gets over. And it is very sad and disheartening to hear news about my fellow nurses and other healthcare workers getting infected in the process of taking care of COVID patients. What makes me more sad is that some of the hospital managements are sending out their own staff on their own when they were found to be positive. And also we hear lots of news about healthcare workers being thrown out of their houses, and they are being stigmatized by their so-called neighbors. I just want the citizen, I just want the people of our nation to imagine once what will happen if this continues and the healthcare workers stop going for work. Who is going to look after the patient? Who is going to save our people and our nation from this pandemic? Unfortunately, frontliners alone cannot contain the virus unless every people realizes the seriousness and contagion of this virus and acknowledge the work of the frontliners, and at least give them peace of mind when they come home from stressful work. My humble request to all the hospitals and the management is to kindly please acknowledge and give equal care and facility to their own staffs, at least, who have relentlessly worked for the patient and the hospitals. I believe hospital management is not only about ensuring best care for the patient, but first and foremost, it's about ensuring that their staffs are being treated well. And on this Nurses Day, I just want to tell the public the best thing you can do for a nurse, or at least as a citizen of India, is by staying home, doing your part, and encouraging others to do the same. And to my fellow colleagues, I want us all to know that no, we were not signed up for this. Nursing was not created to suffer for the patient, but it was created to care for them. We all have had difficult decisions to make, and there will be many more, and maybe even harder in days to come. We are being asked to work in a situation where no one is sure about, where we are being asked to step into a situation which is full of public misinformations, new policies, and the resources are running out. Sometimes it is very frustrating. Every day we give care to the patient. Every day we try to take away some of the pain of the patient. We give care, we give compassion, we treat them with compassion and hope. But in this time, many people forget that healthcare workers are also human beings. They need care, they need compassion, and they need hope too. I want us all to remember that we are here because we can, but others can't. And the world needs us now, and we need each other, regardless of whether you are working in a patient's bedside, or you're working in institutions, or you're working in offices. We are all under the same umbrella called nurses. Therefore, we need to help each other, voice out our opinions and needs to the people, and fight for our rights and fight for what we deserve. Let's take this as Nightingale's challenge and provide the best care, ensuring that we are all safe too, as we all have families waiting for us at home. Last but not the least, I just would like to state a quotation: stay strong not because we have to, but stay strong because we can. Happy Nurses Day.